Over the last 4 to 5 years, Wilmington Health has allowed me to branch into research. Doing hospitalist work, there's a lot of night and weekend work, which inherently means there's a fair amount of weekday time off. With that weekday time off, I've branched into clinical research, been involved in studies ranging from patients with DVTs and PEs to COPD, asthma, diabetes. And it's nice, I get to see patients that aren't necessarily acutely ill, which I would see as a hospitalist, and then also been able to kind of take me a little bit out of my typical day's practice by taking care of patients that don't necessarily have an acute illness. Because I do hospitalist work and I inherently work with subspecialists a lot of the time, a lot of my studies are with subspecialists, whether it's with COPD, asthmatic patients, that we might identify that patient as an inpatient, and then what I would typically do is take care of that patient as an inpatient, then turn them over to the patient's primary care doctor or the pulmonologist once they're outside the hospital, which I would still do. We get to still follow them for that specific disease process if they do enroll in a research study, a research trial. Again, what we've done that with is for COPD and for asthma. Again, a trial that we were very successful with was a study for patients identified with a pulmonary embolism or a DVT. Once they are enrolled in the study, I follow them for the treatment course for that disease process. Research for patients can take two different facets or phases. Basically, you want to match the patient with the right study. You want to put a patient with a trial that doesn't work for them. And then a lot of times for a patient, they'll get a lot of the bigger picture, seeing that their place in the role in clinical research that can help a disease process, the incremental gains that we've made in diseases such as COPD or coronary disease or cancer have come along significantly, and that's not without the help, obviously, of the clinical trial patients themselves. At Wilmington Health, we have partnered with PMG Research. They have been doing research for over 30 years here in the Carolinas. They have a fantastic track record of helping physicians do clinical trials well. With their help, we're able to get good clinical trials, and once patients are enrolled, take care of those patients for that specific disease process that they're enrolled with that clinical trial. So the partnership with Wilmington Health, with the physicians, overseeing the patients, overseeing the trials, and PMG actually helping us run the trials has worked out fantastically.